My name is Dr. Ishwar Gilada. I am infectious disease expert. Today we are going to discuss convalescent plasma therapy in COVID-19 patients. All of us know by now that plasma therapy or particularly convalescent plasma therapy has been discussed a lot in last 4 months. In April, actually precisely on 25th April, I published my article in Medical Dialogues about preparedness required for convalescent plasma therapy. Plasma therapy has been a known therapy, has been used for at least 100 years. It was also used in Spanish flu during 1918-1919. Thereafter, plasma therapy has been also used in SARS, in MERS, and in some other conditions. Now, what is this convalescent plasma therapy? Convalescent means the person who is recovering from any particular infection or disease. In COVID-19, after 2 to 3 weeks, the person recovers and thereafter starts producing antibodies. In antibodies, there are two types of antibodies, IgM and IgG. When the person starts producing IgG antibodies, that is the time plasma therapy, plasma from that person may help in another person who is sick with COVID-19. Now, for that actually we require the level of IgG to be 1 in 1000. But there is no test available in India currently where we can test the level or titer of plasma. So what we are doing in the absence of that, we are just checking whether IgG positive is there or not. Once the person is IgG positive, we remove blood, we separate plasma, we inject that plasma into COVID-19 serious patient, and in that we can see the results. Now, when it was started about 3 months back, the Indian Council of Medical Research wanted people to take license or some kind of permission from ICMR. And my objection to that was that as physicians, we have been using blood, we have been using plasma in different kind of treatments, including say dengue or some kind of blood disorders. At that time, we don't take any special permission. As doctor, we know that the value of blood or value of plasma. We also know there are adverse effects or side effects, and we know how to prevent them also. So this should be part of our standard operative practice in medical profession. So there is no need of any special permission required for that. Now, what is required is a preparedness for plasma therapy. Usually we have a habit that when we require, we start searching where can we get plasma. Now, when there are thousands of patients which are admitted in hospitals, they are going to be discharged tomorrow or day after tomorrow after a week. We should prepare those patients that if and when you get better, would you like to donate your plasma? And I don't think any person will say no. So once you have made that list, you have their inventory, and then when they are discharged, you can call them back after 1 week for follow-up, for your routine follow-up. At the same time, the person can donate plasma. There are some special centers like KEM Hospital in Mumbai. They have plasma fractionization unit where a person can go, sleep there, lie down there, his blood is removed, plasma is separated, plasma is retained for treating COVID-19 patient, and cells are re-injected. But in some smaller blood bank, this facility is not there. But what they can do, remove blood, and in blood there are 3 components, cells which are white blood cell, red blood cells, then platelets and plasma. Plasma is a watery portion. Plasma can be re-injected, cells can be re-injected in that person, or cell can be also used for blood donation or packed cell volume. Now what we need to do is do HIV, hepatitis B, hepatitis C and syphilis test in donor so that we do not pass on the infection from donor to the recipient. Now once this is done, this is called preparedness, and we can create plasma bank in different big cities or smaller places also, and then plasma can be used. Our aim or our goal is to see that the death rate of COVID-19, which was around 4.5% about 2-3 months back, it has come down to 2.3%. If it is brought down to 1% or less than 1%, we have won a major battle, and that is our goal.